Last time we had to put Jackson out. Here are my 5 guests. There's 4, and then there's the 5th. Woo! Okay. Uh-oh. All right, it works. Okay. Obesity is becoming a problem in our country on an epidemic level. Over the past 20 years, there has been a dramatic increase in obesity in the United States, and rates remain high. In fact, according to the CDC, over 1/3 of U.S. adults are obese. Adult obesity is likely stemmed from obesity as a child. Therefore, targeting this problem at an early age is the key to a healthier future. Obesity increases the lifelong risks for type 2 diabetes, high blood pressure, osteoarthritis, stroke, certain kinds of cancer, and many other debilitating diseases. The medical cost of adult obesity in the United States is difficult to calculate, but the Robert Johnson Wood Foundation estimated that the costs range from typically $147 billion to $210 billion per year. To prevent these complications, physical fitness appears to be the necessary solution. Activities like walking, yard work, dancing, swimming, jogging, and tennis are among some of the minor exercises available to most Americans. But sometimes exercise has to be more than just simple household tasks. Some normal but effective ways to exercising are swimming, jogging, and tennis. If overweight and obesity is treated in childhood, some of these health problems may be reversed or even prevented. The CDC states that approximately 12.5 million children and adolescents aged 2 to 19 years are obese. A child is more likely to grow into a healthy adult with a healthy weight. The main way to treat a child who is overweight or obese is to look at changes that can be made to their lifestyle. Such changes include eating more healthy foods such as fruits and vegetables and doing plenty of physical activity. Teaching children how to make wise food choices away from home, like at school cafeterias, restaurants, and vending machines, is an important way for them to be healthy. Teach them to pay attention to both quality and quantity of food choices. More food is not always better for them. Appropriate portion sizes need to be understood. Students in the United States consume almost 400 billion calories from junk food sold each year. With that being said, the American Heart Association stated that on December 2nd of 2010, the U.S. House of Representatives passed the Healthy Hunger-Free Kids Act, which is a reauthorization of the Child Nutrition Act. This bipartisan legislation will give more children access to nutritious meals and remove junk food and sugary beverages from vending machines in schools. Children and teens in states with strong laws that restrict the sale of unhealthy snacks and food and beverages in schools gained less weight over a 3-year period than those living in states with no such policies. Physical activity during school day not only keeps kids physically healthier, but also academically and socially. The Institute of Medicine actually recommends spending on average of 30 minutes a day in physical education class for elementary school students and 45 minutes a day for middle and high school students. It's been proven that the better kids eat and more active they are, the better they perform in the classroom. For instance, students who participate in recommended amounts of physical activity miss less school, and students who eat breakfast at school perform better academically and behave better. Active kids perform better on tests and behave better in class, and more importantly, daily physical activity is essential to help kids improve their health now and create active lifestyles for their futures. Luckily, physical activity comes in many forms, such as PE class, recess, active learning, and fitness breaks, to name a few. This means schools can get students moving more in different ways, even within time constraints of a school day. For more than a century now, PE has been a fundamental part of the American public school curriculum. PE is an academic subject because states, school districts, and schools have all of the requirements for PE just as they do for other subjects such as math, language arts, science, and history. Inclusion of PE as a core subject means more quality physical education programs for students across the country. Currently, the reauthorization of the Elementary and Secondary Education Act does not list physical education as a core subject. However, in 2010, Senator Tom Udall introduced the Physical Act, which is, if passed, it would designate physical education as a core subject within ESEA. Supporting this legislation will send a strong message that physical activity is a priority for our nation's children and a necessary step towards protecting their current and future health. According to the New England Journal of Medicine, researchers predict that if current adolescent obesity rates continue, there will be more than 100,000 additional cases of coronary heart disease attributed to obesity by 2035. As concerns of obesity and diabetes continue to increase, it is more important than ever for students to make physical activity a part of their daily lives. The end.